Welcome, everyone. Another great video talking about health benefits. Health benefits while you're working, then you're retired. How do you pick health benefits in retirement? We're tackling that today. We brought along a guest to help us with that topic. Kevin, let's just dive right in.
Yeah, that's exactly it. We want to talk about health benefits in retirement. And specifically, I mean, you're working, you have coverage, and then when you're not working, what do you do? What kind of different coverages do we have in retirement to help us with our healthcare options, Adam?
Well, you do have a variety of options available. So as you know, as you probably enjoy today, you get to, go for a massage appointment, go to your chiropractor, pick up medications at the pharmacist, and likely have most of that covered by your plan through work. So what happens when you retire? Well, your work coverage does stop at that point in time, and you have the options. Well, do I want to pay for everything out of pocket? Or do I want to continue with some sort of group benefits health plan in retirement time? And there, again, are a variety of options. So it's a matter of finding what is the right fit for your particular situation and your risk tolerance.
Okay, so folks
go ahead.
Are nearing retirement. So obviously there's a difference there between working and retirement. As we get to those retirement years, what should people be considering? What are the differences? What do they have to know about health benefits in retirement?
Well, first, you want to check, what happens with your benefits at retirement. Some employers will offer a retiree plan. Often these plans are less coverage than what you have today as a regular old employee. You might get less prescription coverage, you might get less dental coverage, you might get less other health benefit coverage that goes along with it. So you really want to compare your options. You also want to think, well, what are you using today for those benefits? Are you using them to their fullest? Well, what happens if those benefits disappear on you and you have to pay for all that out of pocket? Again, just really evaluating what's unique to your situation. Or if you did have unexpected prescription costs, as an example, or hospital stays in retirement time, would you be able to pay for those out of pocket? Those would be important things that you do want to consider. The other thing is you have a limited window that you have to make some of these decisions, right?
Time frame, yeah.
There's a time frame. So it is time sensitive. You can't just retire and say, I'll think about it for a year and then decide if I want to get coverage. You can, but you do take some additional risks. So most plans that exist for retirees, you have the option at retirement to transition to a plan that you own, you're paying for yourself within either 60 or 90 days. Every carrier is slightly different as to what their rules are. I'd use 60 days as a rough guideline. If you transition within that 60 days, you can roll over to the plan without having to prove that you medically qualify for it, which is huge, right? Especially if you're on some medications, you have some pre-existing conditions, it might be harder to qualify for a plan. If you're perfectly healthy, you can also apply and see if you can get a better level of coverage with medical underwriting attached to it. So often there are plans that do have, maybe a higher dental limit, maybe a higher prescription limit, all of those things with the medical underwriting attached to it.
So that time frame is key, and you're saying it does vary, but 60 days is a good guide. So if you've got some pre-existing conditions, you don't want to go through the underwriting because maybe you get a worse deal if they do the underwriting. You got to make a decision rather quickly.
You have to make a decision rather quickly, and it helps. You're retiring in 6 months. Start looking into your options already. Compare the plans. I'm sure you two know, but maybe not all the clients know, but we can offer some health plans directly on our end. So we do offer it through a few different carriers. Happy to shop it around and find the best fit for your particular set of circumstances.
Yeah, and so if you want to get in touch with us to try and get that, or you want Adam to pull anything up, please go to chatwithclintonandkevin.com. We'd be more than happy to take the information down or put you in touch directly with Adam to be able to get information on these plans. And you've mentioned before that there are a variety of plans. It's not just one size fits all, right? You can choose what your benefit coverage is to a certain percentage, yes?
Yeah, that is correct. So there are, it always comes down to what you're willing to pay for in the end.
Yeah.
Obviously, the more you pay, the more benefits you happen to get out of the whole deal. So this is one example from one provider. But it's looking at, what is your priorities? Do you want more prescriptions? Do you want more other services like massage and chiropractor and physiotherapy? All of those things. Is dental a big priority for you, or is dental not something that you're willing to pay for? All of these different factors do impact the cost that you're going to have to pay. A lot of these plans either include travel insurance as well, or
Nice.
have travel as an add-on for an option, which typically covers to, maybe 30 days, this example, 60 days of travel. As you can imagine, you're 65, you're retired. Well, you're probably hopefully going to travel in retirement time, and travel insurance generally only goes one direction for cost as you get older, which is
Yes.
up, right? So if you can have some of that basic travel insurance already covered within this plan, I mean, that is also an advantage. So again, it's really comparing what are you going to get the most value out of when you're paying for this type of plan, and then picking the right option. So again, that's one example. That was for the plan where you can just roll into, and then it's a whole nother set of options if we look at the plans that are underwritten.
Okay, so lots of details there. And again, this isn't about trying to find the perfect one in a 10-minute video. You really do have to do your homework and see what's right for you. But I think what a lot of folks will be thinking of right now is, okay, I get there's lots of options. What does the cost look like when it comes to these benefits in retirement?
Yeah, that's always a big one.
Yeah, that is always a big one. So, we did put together one very high level example. Obviously depends on your age, spouse or no spouse, your province. Do you want dental, and which option are you wanting to sign up for? So this example here, you see the premium as the monthly cost there moving forward. So you might not have noticed this as much off your paycheck in the past because it was just coming off. Maybe the employer subsidized some of the cost for you, but now in retirement, you have to pay this entire cost on your own. So that is something to be aware of. So also looking at it saying, is that cost mitigating the risks of the unknown expenses in retirement? Does it give me some additional peace of mind, as all insurance is designed for, giving you peace of mind that you're not going to have some sort of catastrophic situation and not have some funds to deal with it? Okay, so that is a big determination when you're looking at these benefits.
Yeah, and a quick item here when it relates to costs, and this is a point you told us before we hit the button here today, is that there is some benefits. You can get some tax deductibility, but you have to make sure you meet the requirements for that.
Correct. As it is with all medical expenses, CRA sets the rules and the limits as to how you can deduct some of those things off your tax return. So there is a description here on the screen. So typically, most plans that you're looking at in retirement are focused towards medical expenses, not disability or life insurance. So it should meet these definitions. If you do have any concerns, obviously chat with your tax professional when it comes to understanding the tax credits and deductions that are available to you.
Yeah. So as a wrap up there, and Kevin, maybe you want to talk about this as well. It's really about fit. If I'm getting one takeaway from Adam here, it's that there's no one size fits all. It all has to come down to your unique needs.
Yeah, exactly. I mean, basically, the understanding is there are plan options available. Besides, if your company doesn't offer it, you can come to us and we can look at some options for you. There are a variety of different things that you can do, a variety of different costs and coverages. But again, as it's been mentioned, fit is exactly what it is. So if $400 a month or something isn't for you, but there's a plan that covers most of your stuff for $200, there's a fit that you might be able to deal with on a cost size. And it may fit all your needs with, depending on the percentage of coverages you want. So fit is the main important thing that I would say has to go along with this, correct?
You are correct. It's all about finding the right fit and the right solution for your particular set of circumstances. There is no one size fits all when it comes with insurance or planning. It's a matter of finding the right solution for you.
Perfect.
Just like us, you customize everything.
That's correct. Exactly. They build a custom portfolio. I build custom insurance solutions.
There we go. Well, it's a good place to end it. We'll put this back on the screen, chatwithclintonkevin.com. It says chat with Clinton and Kevin, but you can get Adam too. Like no extra cost. We throw that in. You go to chatwithclintonkevin.com, fill in the form that comes right to us. If you have a question for Adam or need a little help with your health benefits in retirement, please let us know. As a team, we'd certainly be happy to hear from you. I think we'll leave it there for today, and we'll be back again soon with another video. Take care, everybody.